From the 22 News Plus studio, this is 22 News in Focus with Patrick Berry.
Hello, everyone, and welcome to this edition of InFocus. I'm your host, Patrick Berry. We are here in the 22 News Plus studios. Today, we're having a conversation that, if it hasn't affected you yet, it will most likely affect you and your family. It's about dementia. Joining across the desk from me today is Michele Anstett. She is the president, director, owner of Visiting Angels right here in the Pioneer Valley. And she knows more about dementia and dementia care than any of us, which is why she's here. I have family members who are affected by it. You have family members who are affected by it. A lot of people do. But I have to be honest, even though I have a family member affected by it, I don't really know much about it. So, Michele, because dementia's kind of like, it's like Kleenex. Kleenex is tissues, and I think dementia is sort of the same way. It's sort of an umbrella term, right?
It is. It's a overall term, and there are many different types of dementia. They all affect the brain.
Okay.
And the one that people are most familiar with is Alzheimer's.
Okay.
But there is Lewy body
right.
dementia. There's many different types, and it affects the brain in different ways.
So dementia is the overarching description of memory-related issues,
Yes.
I guess, for lack of a better description?
I guess that is probably a very good description.
So through your travels, I mean, obviously you have a business that deals with this. Are there a lot of people that have memory-related issues? And again, and then it's we joke, where did I put my keys? But there's that, and then there's medically determined dementia.
Exactly. And there is a lot. There is, and then there's, what's scary is there's even more that are not diagnosed.
Really?
And also there are people that kind of sense there is coming on, but they hide it because they don't want that
shame
or stigma, which is sad because today there are so many different medications or processes that can help delay.
That brings up a very good point. Is the treatment and care for dementia-related brain issues, is it advancing, and is it better today than, say, it was 5, 10, 20, 30, 50 years ago?
Oh, definitely.
Okay.
I mean, today it's even better than like last year.
Really?
They are really, the Alzheimer's Association is really discovering different reasons why this is happening. And I believe that they are actually, I think they are coming up with a vaccine or something that
a treatment.
A treatment that
to slow it?
It's a test that will help determine early on if you are at risk.
It's funny. Now that you're telling me this, I do remember reading something about that, where there's a DNA test you can take.
I think it's a protein, something to do with protein.
Exactly.
Yeah.
But, I mean, that opens a can of worms. Do you want to know or do you not want to know early on?
I think that is, that has happened with a lot of, like, for instance, breast cancer. Or, you could do a test and people have to struggle with that. Do I want to know?
Right.
Or do I,
Whereas I think for cancers, I'd want to know because today, cancer is far more curable than it's ever been. And it's only getting better, more curable.
Right.
But dementia, you can prolong it, I guess?
Yes.
It's not curable.
It's not, but you can prolong it. And your quality of life for you, for your family members is so much better than, say, when my grandmother passed away from dementia. When she passed away.
And what year was that?
That was 2000.
Okay.
So
So a
25
couple
years.
decades ago. Yeah.
Yeah. So when she passed away, I mean, she was in a nursing home, and they didn't have a lot of options.
Right. They probably didn't really fully understand how to care for a person,
No, and it was known as
even as recently as 2000, the year 2000.
yeah, it was known as the elder disease, the
Right.
forgetful,
Yeah.
But now I would strongly encourage people, and this is just such, it just makes me smile because now we have this ability to find out, are we at risk,
Right.
and prolong the effects of it,
Delay it.
delay
Yeah.
it. And the sooner you can, find that out, and the sooner that you can start that process, the longer you're going to have with
A functioning
a
memory,
really
right?
good quality of life.
That's what everybody wants. It's just a
And
good quality of life.
yes, isn't that what life's about?
Exactly. Living long and remembering to live,
Right,
your loved ones.
right, right. And having, just life, and a good life. Um, and that's, like I said, not just for you, but the people around you, your family
Exactly.
members. It is just so, ah, it's so hard when you're watching a loved one suffer.
Mhm.
And in a way, I my father, he he knew he had it, and he was trying to really cover it,
Fight it.
fight it,
Yeah.
cover it. He because he remembers what happened to his mother.
Mm,
But it is not like that now.
right.
Now, I encourage anyone to
Learn more about your body.
learn more
Yeah.
and seek the help. Don't hide it. Get the help before.
We are up on our first commercial break. It's a perfect way to end because when we come back, we're going to really dive into getting the help that you need. Stay with us. We're back in a moment.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to today's edition of In Focus. Sitting across the desk from me is Michele Anstett. She is the president, director, owner of Visiting Angels right here in West Springfield, Mass. Michele, thank you so much for joining me today. We're having a fascinating conversation, important conversation about dementia, memory loss, and memory-related issues. You have mentioned it a few times, and I want to make sure we really have this conversation. You've kind of made it in passing about it's not just the patient, it's the family. And I think we all know. I've got, I have immediate family that's dealing with it. I have very close friends who have dealt with it and their parents have passed. It is difficult for those
Oh,
who
yeah.
aren't. And there's help for the family too.
Yes. Yes.
So let's talk about let's go progressionally. So the care of the patient who's starting to have a memory loss issue from let's say diagnosis or maybe even before that.
Usually before, yeah.
Okay, so walk me through it.
So usually, it is either loved ones, either family or friends,
Recognizing it.
that are recognizing it,
Okay.
neighbors, and it starts out mild, and then you can see that progression.
Right.
Again, I strongly encourage family members or friends that are noticing something to have that conversation in the best way possible with the person who's having that memory issue, and encourage them to
But
seek
that
help.
has to be an extremely difficult conversation to have because the patient, for lack of a better description, will fight it. No, I'm fine. I couldn't remember,
Yep.
my niece's
It's
name
true.
or whatever it is.
Yeah.
It's just it's getting older,
Yep.
you know, but
It is
it's a
so
difficult
true. It's
conversation.
very difficult. And if you, as that person approaching the other person that you feel is having some issues, if you need to get help,
Mm,
I would encourage reaching out to groups, Alzheimer's association groups,
right.
any type of professionals to find out how can I have this conversation. And for each person, it's different.
Right. I hate to say this, but maybe tricking the patient into a diagnosis, like, oh, hey, maybe talk to the doctor first and go, hey, this is something I'm struggling with, mom or dad or
Mm,
husband, wife, or whatever, and just say, can we come in and you just sort of, hey, you're hitting the age where, memory issues are starting to become a problem. Let's test you for it. So
yeah,
kind of trick them into that. So it's not you, the partner, or you, the child, saying, mom,
yeah,
does
yeah.
that help, or am I
I
kind of off base with that?
my personal opinion is to be as honest as possible with your loved one.
Okay.
Um, and have that conversation before you need to trick them.
Good point. Good point.
But again, every every person is different in what works for them. In knowing your parent, what will work for one will not work for another. Just
Right.
and you have to really kind of focus on that. It may be that you might have to say, "Hey, let's just," but it might also be, "Hey, how do you feel about your
Right.
memory? Do you feel
What are,
there?" Yeah,
one of the things I have heard a lot is you should never argue with. So if a person,
no,
that might be having the memory issue, starts repeating themselves,
yes,
the loved one shouldn't be. You just told me that.
yes,
Just kind of roll with it a little bit,
you
right?
do.
Because if you don't, that just creates anger.
Yes, it does, and frustration. There are so many wonderful things that you can do to divert the attention to something else. But yeah, it's very important for you to be educated also in what is going to be the best for the situation. And usually, trying to prove that, oh, you just said that, or trying
Right.
that's not
Right.
going to
That's
work.
just creating more problems.
It's creating agitation.
So,
Yeah.
Michelle, let me ask you, as what kind of care is available? So if somebody we recognize has a memory related issue, what should we be doing? Should we be, again, their memory's not so great. Should we be keeping them in the house so that they're not getting lost or not wandering in, or is exposure to other people, environments, activities?
Mm.
We always heard, diet and exercise are some
Mhm.
of the best things that you can do as you age. Is that the same with a patient that has memory loss? Kind of keep them in group settings, maybe
Yeah.
socializing more?
Yeah, definitely. As society and social settings is so important to the personal being, um, and it just helps further your brain, um, keeping it active and
And stemming the advancement
yes,
of it.
stemming that advancement. And so, as long as it might have to migrate into a different, you know, visual of what that socialization is. For
But that's no
instance,
different as it's growing older.
it is. It is.
Socialization for our age
Yeah.
is one thing. Socialization 10 years from now is different. 20
Yeah.
years from now is different.
Or previously.
Right, exactly. Yeah.
So it's going
Good point.
again with that individual and what works for them.
So for someone, for a loved one that recognizes this, should they already be seeking out a professional in the field for guidance?
Definitely.
Okay. Because you can't
Definitely.
know everything, and the internet is not going to give you every answer
No.
because each person's
And you have to
unique.
be careful about what's real, what's not real.
Mm,
But definitely there's a lot of groups, support groups. Usually people start with maybe a friend
okay.
that maybe has gone through the same thing. And then, and then it branches to maybe a professional or, a support group. And then hoping to get that diagnosis so that that person can get the help that they need as early as possible,
Right.
so as to prolong the damage that this disease
Right.
does.
We are up on our second commercial break. Stay with us. We're back in just a moment.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to today's conversation here on InFocus. It's an important one. We're talking about memory-related health issues. Dementia is the overarching umbrella name for more than 100 different memory-related issues. Alzheimer's is probably the one most people know because it affects most people. But sitting across the desk from me today from Visiting Angels in West Springfield is Michele Anstett. She's their president, director, and owner. Michele, thank you again for joining me. I appreciate it. The last segment, we started to talk about care. There are a number of different ways to care for a family member, a loved one who is having memory loss, memory-related issues. And the care changes as the memory gets worse and worse and worse. When we first, just before the break, we were talking about the early age, the early stages. Keep them socializing. But there are other ones. There's in-home. There's programs that you can take your loved one to. I guess talk to me a little bit about the different programs that are available and the importance of each of those.
Yeah, there are so many different options. And again, I know I keep saying this, but it's true. Not every option works for every person. So it's wonderful that there are that many different options.
Right.
There's independent living, there's assisted living,
And those are
memory care.
progressive. So you go in and you kind of take care of yourself, and then as your health deteriorates, you get a little bit more care, a little bit more care.
and then a little bit more.
Right.
So there's that option. There's in-home care, where people go into their home and manage, what they need. And it might start out with just a little care, and then it increases.
It's good, making lunch.
Right. And it's good to start just in that early stages so that they're more acceptable or accepting, I should say, when, they need personal care.
Yeah.
It's caregivers that go into the home become the client's friends.
Exactly.
And it's a relationship. And it's trust.
And I don't know how those people do that because
they're amazing.
You watch the slow progression of somebody's mind deteriorate.
Yeah.
And you become a friend.
You do.
And then when that person passes, it's devastating. And the weird part to me for those caregivers is then they're on to the next person.
Right.
And God knows how many years that lasts. And then they're on to the next person, so.
Yeah. And
it's a hard job.
It's hard. It is a hard job because you've developed that relationship and you're watching that decline. And yes, when they do pass, it affects these caregivers
absolutely
immensely. It affects even us in the office immensely because they are part of our family.
Yeah, you've been tied and connected to them for
Yes,
could be years.
We've had clients for 10 years.
Wow.
And so when somebody passes, it's more than just, okay, we're on to the next one.
Right.
It is, many times it's caregivers taking time off because they need that time to regroup before they can move on to the next.
And that's respite care, right? And respite care, I don't think enough people understand. I quite frankly didn't understand respite care until just a few years ago.
Yeah.
But it's relieving the family caregiver. If I'm boiling it down to its simplest terms, respite care relieves the family member who's doing the primary care.
That's exactly
because as we've learned and we've heard, you get that burnout.
Yes.
And a lot of times the person doing the care may have their own health-related issues because of all the care that they're giving.
Yes.
And how many times does that person pass away before the patient passes away?
Right. Exactly. I mean, it happened personally for my situation.
Really?
My mother, who was not in good shape, was taking care of my father with dementia.
Wow.
And it's very difficult. Respite care is very important. And there is a new program coming out, which everyone is very excited about. It's called the Guide Program. And that is, it is an 8-year long grant study, not study, but grant for care for helping out the person who needs that respite.
Wow.
So there are funds that are available that people give the caregiver, family caregiver,
A weekend away, a night away.
Yes.
Something simple.
Yes, just to be able to go out and get their hair done or something.
Right. The hard part, I think, with memory-related issues is it's not like cancer. It's not like heart disease. It could go on for years. It could go on for years.
Yep.
And that's the hard part is the caregiver.
Yes.
You might think, oh, all right. I mean, think of, I don't know, folks, if you've got a loved one with memory-related issues, but think of how long they've been around, and
Yep.
again, the family member that's giving the care, it could
Yes.
be 5, 6, 10 years
10 years. Yeah.
or more
Yep.
that you're dealing with this.
And when I brought my
And slowly getting
mother-in-law,
worse.
yeah, when I brought my mother-in-law from the time that I brought her to get that diagnosis and went to the time, I think it was about 10 years
Wow.
to when she passed.
So, one of the things I asked you before about seeking professional help early, how important is that? Not just from, okay, here's what you can expect, but maybe the treatment side of it,
Yes.
of, you mentioned possible, not vaccines, but medications that might
Yes.
stem the advancement of it.
Yes, they're so excited because we're finally making some strides. So diagnosing it early, that helps with, okay, now we've got these medications that once we know and we start it like right away, we can prolong these the onset of these terrible effects.
Wow.
And that's exciting news.
Absolutely. Absolutely.
Yeah,
There's and as we stated very early in this conversation, the Alzheimer's Association is making great strides in the care and treatment of memory-related issues.
And I strongly recommend, when you hear about the Alzheimer's walks and raising funds, definitely you can see
Right.
this is where that money is going to.
Absolutely.
So,
Michele, I can't thank you enough for joining me today for this conversation, important conversation for all of us. So thank you for giving me some insight. I appreciate it. Good seeing you.
thank you so much for inviting me.
This is 22 News in Focus with Patrick Berry.